Hi, I'm Dr. Sarah Cook with Pure Chiropractic. I want to welcome you to our practice. I want to congratulate you also because to me, you've made the best healthcare decision for yourself that you can. I want to go over a couple things regarding why I show up to work every day, why you lie on the table, and how we're going to get you truly healthy. A lot of people focus on the outside-in approach in today's society, and so what they're doing is they're not moving well, they're not eating well, they're not thinking well, and they're not getting adjusted. So think of someone that you know that's really truly struggling out there. Are they doing these things? And if they are, then they're on the wrong path. So what today is I'm here to welcome you to your new path to get you to a better you. In today's society, we're focused on doing the outside-in approach of just masking a symptom, covering up something that's going on in your life instead of really getting to the bottom of the problem. 1 out of every 50 kids are being diagnosed with autism. Let me ask you something. Are the numbers going up or are they going down? Yeah, they're going up, and they're going to continue to go up. More than 350,000 Americans are on dialysis. 50 million Americans suffering from allergies. 23.5 million children and adults in the U.S. have diabetes. So now our children at a younger age are being affected. They're getting sicker quicker. 74.5 million people in the United States, ages 20 and older, have high blood pressure. And what we do is we spend over $20 trillion in the last decade to try and resolve this. But if the numbers are going up, the deductibles are going up, the premiums are going up, sounds to me like we're going in the wrong path. So let's take a turn and let's focus on something else called health instead of sickness. Have you more faith in a spoonful of medicine than the power that animates the living world? I don't. That's why I'm a chiropractor. I believe that the power that made the body can heal the body. And so with you, I understand that if we left here today, got into a car accident, and one of you pull up and you see my femur sticking out of my leg, you don't bring me in here for an adjustment. You take me to the surgeons. You let them do their job. Put me back together. But as soon as I'm stable and able to leave that hospital, the first place I want you to bring me is in here for an adjustment. Why? Because my body is going through a tremendous healing process. And if I've been through that much trauma, I'm hoping and praying that my body will be able to recover the best that it can. But without nerve flow, it can't. And so that's why people start to get adjusted after a traumatic event. Now, besides the traumatic event, let's go over some basic understandings as far as how we base our health versus sickness. So when we're all born, we're born in a good state of health. What happens is we start to get under chemical, physical, and emotional stress. As that starts to happen, we start to get stressed out in our muscles. It starts to stress out the nervous system, pulling on the bones, creating what we all know as subluxation. Subluxation is where the bone misaligns in the spine. Now what happens when the misalignment happens is it pinches on the nervous system, causing the body part to malfunction. That can be the heart, the lung, the liver, the muscle, the cells. Once that starts to happen, it starts to malfunction, then you kick into a state of disease, pathological. So then, what's next? Symptom. Here's where most people come to a chiropractor, is when they're a symptom. What I'm trying to preach to the world is that you don't have to wait for a symptom. Because what happens to Uncle George that died of a heart attack last night? Was it the pork chop that he ate the day before? No. It was a buildup and an accumulation of bad decisions throughout time that caused him to finally have the heart attack and then death. Don't wait till this point. You have the opportunity to start working on your health. Each decision that you make on a day-to-day basis brings you either closer to health or further away from health. So it's up to you on what you decide to do. And to me, you've made the best decision of moving forward to get better health. So let's keep going with it. I want to take you back to why we treat children, why the nervous system is so important. We're going to go back to embryogenesis. As soon as the sperm meets the egg, there's a couple things that take place in the first 24 to 36 days. On the 24th day, mom doesn't know she's pregnant, baby forms a heart. On the 36th day, the baby has eyes. But I want you to look at what happens in the very beginning. On the 7th hour, you have a nervous system. What do chiropractors focus on? The nervous system. So you create a brain, then you have a spinal cord, and from there, you start to create all the body parts. You have what we call innate intelligence. Innate intelligence is going to take the brain and the spinal cord and it's going to create your heart. How does it know how to do that? Is it the educated brain from the mother, No, it's the innate intelligence from the baby, the body's ability from a higher power to create this human being inside the mother's womb. At 5 weeks, it knows exactly where to put the arms, where to put the legs, and start to grow it. At 11 weeks, the baby has everything that it needs to have. It just needs time to grow. So now, how does the body know where exactly to put the eyes, where exactly to put the ears, where exactly to put the 10 fingers and the 10 toes? It does it through innate intelligence, all from the brain down the spinal cord. So wouldn't you think that that is truly the most important part of the body, the nervous system? That is what we're focusing on. That is why you lie on the table every day, is to make sure that your brain is telling your body part exactly how to grow every single day of your life. If there's no interference, then you get a beautiful miracle. So when we start to grow, we start to learn how to crawl, we start to learn how to ride our bikes, walk, run, play sports. What happens? We get injured. And so whenever you get injured, does the cast do the healing? No, it puts it in a safe environment. What truly does the healing? The nervous system, absolutely, yes. So you're gonna break down old bone, you're gonna build new bone, and it's gonna start the healing process. But it can't do it as quickly if your brain isn't able to send the signals down to the body part. Now let me ask you something. If you go to the dentist and he accidentally slips, cuts the root of the nerve to your tooth, what's gonna happen? It's gonna die, it's gonna decay, you're not gonna have it anymore. So you can brush, you can floss, you can gargle as many times a day as you want, but it's not gonna bring the tooth back. So my question to you is, what is the difference in cutting the nerve and getting a subluxation? Nothing, it's just time. So throughout time, you pinch on the nerve and then you start to lose function to that body part. It just happens throughout our lifespan. So that is why it's so important that we get adjusted from baby all the way until we are great-grandparents. When the body is working as a whole, the brain is trying to send the signal down the spinal cord and out all of these nerves to all your cells, your muscles, your tissues, and organs in the body. So let's think of something. If I come right here and I pinch the nerve that's going to the heart, is the heart going to work properly? No. But what are we trained to do? We're trained to run to the cardiologist and say, what's wrong with my heart? If it's moving too slow, they're going to give you a pill to speed it up. But we're not deficient in a medication, and that's why the heart's moving slow. So what we do as chiropractors, we take a step back, we look at why is the brain not able to tell the heart what to do? Is it being pinched right here? The communication is being lost somewhere. And so we're going to start to remove those subluxations. All of these nerves are doing over 2 trillion functions per second. That's a lot of work that the body's doing. You have to give it the clear pathway in order for your body to be able to do what it needs to do. So subluxation, let's go over that. When you look at the spine, we should have nice curves from the side. Straight in the back. Optimal spine, optimal health, no problems. But what do we do all day? Sit at work, sit at computers, look down, sit in the same cars, same chairs. We create misalignments in the spine. What happens then is you're pinching on the nerve. The brain isn't able to send the signal down and go out the nerve to where it needs to go to. So what you're doing with your chiropractic adjustments is slowly throughout time getting more nerve flow because you're removing the interferences. When you remove the interferences, you diminish the amount of subluxations you have per day. So here, let's go over some frequently asked questions that I get a lot. The first one is, should you get adjusted if you're sick? Absolutely. I don't care if you've already been in twice this week. Call me and get in, because what's happening is your body's trying to fight something off. It needs more power. I don't have the flu adjustment, or I don't have the stomach bug adjustment, but what I do have is an adjustment to clear out the nerve pathway so that your brain can send the signal down so your body can heal a lot faster. What if I'm running late, miss an appointment? So if you miss an appointment, the goal is to get your adjustments in the time frame that you and I decided. That is vital. That is how I know what your end results are going to start to look like and make sure we're on the right track. So if you're going to miss or go on a vacation, just make sure that you contact us, and that way we can get you appointments made up. Now, do a 10-minute window on running slightly early or late. So if you're beyond that, please call us, put us on speed dial. We'll help you get the right time for you. Because what happens is if you're running slightly late and I'm with a new patient, the same respect that I gave to you, I like to give to others. So please just put us on speed dial and make sure that you call us if you're going to run early or late. Please be patient. Everybody is going to heal at their own pace. but everyone is starting to get more nerve flow into their body as soon as they get that first adjustment. Your body is going through a healing process. You have a lot of stress that we're trying to work on throughout the nervous system. It will take time, but just please be patient. You are going through the healing process and you're doing great. This is cervical tractioning. At the end of your initial phase of care, we will introduce the cervical tractioning right here. What this does is this really works on the curve in the neck to try and get the head to go back and offset what you do on a day-to-day basis looking down. I will introduce this to you when the time is right. Let's first focus on getting you more nerve flow. Okay, so let's review the 3 phases of care. Right now, everyone is in the initial intensive phase of care. We're just waking the nervous system up, reduce, eliminate symptoms. That's it. Once we get at that point, we'll take a set of films, hold them up side by side, and we'll see what the body is willing to do, what the changes are being made. We're then gonna hopefully move you to once a week. At this point, we're going through more of a rehab stage, trying to train the body to hold the adjustment for once a week and wake up the nervous system a little bit more and try to get the muscles, tendons, and ligaments to stabilize the spine. After that, that's the remaining 9 months of the year. We're gonna put you into our wellness phase. What the wellness phase is to do is we've gotten you where you need to be, let's keep you there. Let's keep you moving towards better health. At that time, we'll talk about the wellness care. So let's take a look at this chart as you're with us throughout time and how your health is gonna increase. In the first 3 months, remember, we're focused on getting you more nerve flow. You're gonna feel great at that 3-month mark. But let's say you decide that you wanna stop. You're not healed. You are not at the point where you are stable just yet. So what's gonna happen is slowly throughout time, your health is gonna start to decline. You're gonna start back right where you were. So as you stay along the rehab stage and then you get into the wellness care, your health is always gonna start to increase. So just stick with it and we're gonna get you more nerve flow and get you to a healthy point of view. Okay, water and supplements. So I'm not a nutritionist, but I do know the basics. Water, you gotta take your body weight and divide it in half. That is the amount of ounces you need per day, and that's a minimum. Make sure you get them, no excuses. That's gonna really help the body heal itself. Also supplements, there's four required supplements that I talk about in my office. A multivitamin, vitamin D3, fish oil, and a probiotic. You've gotta start working those into your health. What's happening is we're gonna get you more nerve flow. Now you've gotta send the body the good nutrition to really get you to your optimal health. How many workshops should I come to? We're gonna provide you with a monthly workshop to really start to increase your health, to find better ways that you can start to break bad habits, form new habits, how to get yourself to eating better, thinking better, moving better, and also to understand why you're truly lying on the table to get adjusted. We're also gonna provide you the Bonfire program, which is focusing on those 4 things throughout the series of workshops. When you're seeking your full potential, you can't just pick one. You can't just come in and get adjusted and leave every day and go eat McDonald's, smoke cigarettes, drink alcohol, sit on the couch and eat a bag of potato chips. You've got to work at it. Health isn't going to get you to the top, but you've got to really work hard. It's easy to get lazy and unhealthy. It's a challenge to get you to where you need to be. So whenever you're seeking full potential, you've got to have all 4. You can't just pick eating well and leaving thinking well out. We all go through a tremendous amount of stress. So we've got to find the balance of all 4 of them to get you where you need to be. Today is about you, but I do expect that your friends and your family come in for a checkup. We all have the same nervous system, whether you're 100 or whether you're 1 day old. Everybody should have their spine checked. Why? Because the nervous system is what controls it. So I know today is about you and this workshop is about you, but in the future I do expect that you will have your friends and family checked up. Also, how long does my family need to be adjusted? How long do you want to stay healthy for? Your nervous system is what gets you to that 100 years old. How clean do you want to have it? You only get 1 nervous system, you only get 1 spine. Treat it the best that you can. I have 2 expectations in the office. The first one is commitment. I can't help you if you're not here, so please be here when you're supposed to be here. You and I together, we have goals to get you to a healthy point. That's you on a rhythm and repetition of adjustments. Please just be here when you're supposed to be here. Also, I'm confident that you're gonna get great results. All I ask is that you go out and you share your story. Why? Because a lot of people don't understand what we do in this office. We're very unique chiropractors. We focus really on getting you healthy. We don't talk a lot about pain in the office. Why? Not because we don't care about the pain, but because the nervous system is what controls every function of the body. We have a lunch with the doc. We also have quarterly workshops, dinner talks. So please don't hesitate to call our office and get set up for those. So who do you know that needs their power turned on? I encourage you to go out and tell as many people as you can. We're very unique in this office. We're trying to get you to a point of health, better health. We don't focus a lot on pain, not because we don't care about it, but because we've got to get you past that point and get you healthy and keep you there. We're supposed to live till 100 years. We beat our spines up every day. Please share your story. I truly appreciate you trusting me with your health, and I'm excited to take care of you in the future. Thanks and God bless.